Okay.
Oh, that's fine. That's fine. We can do that.
Great, thank you.
So that yellow there and just prove what the good time was in 70s film noir.
We're getting everybody admitted. Thank you for your patience this morning. Got quite the crowd. Well, I'd like to welcome everyone to the December 9th IRDC Zoominar. I'm Mark Reinig, president of the IRDC. My day job's the community and economic developer for community and economic development within ISU Extension. A few notes before we begin. Our last Zoominar of 2022, please mute. And this session, as you saw, will be recorded and posted at a later date on the IRDC website. And there will be time for questions after the presentation, but Mary will be asking questions of the audience. So please use the chat function to answer those, or if you have any other questions, you can use that in the chat also. Next Tuesday, December 14th, we are having our quarterly meeting, the IRDC, and jointly with the Empower Rural Iowa in Nevada. We have had overwhelming response and registration has been closed. I don't know if we'll have that on Zoom or not. Bill, do you know if that's going to be able to have Zoom capabilities?
I'm actually going to defer to Liesl on that. I don't think so.
All right.
No, it's going to be in person.
Okay, well, because of the large number of people we have, that'll be a good lesson when you have these meetings, register early. But anyway, today I would like to welcome Mary Lawyer, Wellmark Foundation Director and Director of Community Health Improvement. Mary will be discussing Wellmark's Matching Assets to Community Health Grant Program and Wellmark's Healthy Hometown Initiative, among other things. And we're happy to have Mary with us this morning. And Mary, it's all yours.
Well, happy Friday, friends. I'm going to ask, first of all, what do you see on your screen?
We see you.
Oh, so I need to share. Okay. I thought I was sharing, so I apologize. Now what do you see?
Now we see your slide deck.
Okay, great. Thank you, everyone. So I'm really happy to be talking with you today. Wellmark truly values the Rural Development Council and its members. We've worked with many of you, so it's a privilege to be here today to talk about some new things that we're working on. I want to start, though, by asking you a question. I can move my slide. Try this. So I want to ask this question. Which would you choose? Would you choose a long life with poor health or a short life with great health? And Bill's going to help me with the chat here. You can put an A or B in the chat. Because sometimes I know I take my health for granted. But if you stop to think about it, this is a pretty profound question. So what do you think? What are people saying, Bill?
Overwhelmingly B.
B. Okay. Well, you know what? I think this is an awful choice. I think everybody should have the right to a long, healthy life. And we believe everyone deserves the opportunity to live a long, healthy life. But some people are born into or fall into circumstances where the odds are stacked against them, and that path is just difficult. In Iowa, if you have a high school degree or less, you live in a family income that makes less than $50,000 and or you're a racial minority, you're more likely to have a shorter life and poorer health. In fact, average longevity for an Iowan born today is 79.4 years. And if you're Black Iowan, it's 74.4, so a whole 5 years less. I'm going to share some Iowa statistics with you. And while I do, I'd ask you to think about the data and imagine how it impacts your community, the people you know, your company, the workforce you're trying to recruit, the kids you're raising in your community. Think about whether some of these statistics could be improved with work on our part. So Iowa State's health assessment reports that 14 Iowa counties have a life expectancy greater than 80 years. So 81 or over. If this is true, then not many Iowans are going to see their grandchildren grow into their adult years. This one you probably know is, as the rural areas shrink in population, it typically means that sometimes the people that are left have less money, are older, and may be in poorer health. Urbanization often leads to challenges for access to employment, education, and healthcare for rural Iowans, all things that are very important to living a long, healthy life. So this slide, when I look at it, it makes me wonder about living wage. How much money is enough to meet basic needs? There are lots of articles and sources that talk about living wage. One I found is MIT's living wage calculator. It contends that in Iowa, for a family with one adult and one child, the adult would need to make $32.77 an hour to support their family. And a family with two working adults and one child would need $18.43 to meet their basic needs. Now, I'm not going to argue what calculator is right or wrong. There's a bunch of them out there. This one takes into account, it says basic needs: food, childcare, health insurance, housing, transportation, clothing, and personal care costs, but not things like a movie or a restaurant visit for the family. People of color in Iowa, ages 0 to 24, are much more likely to experience poverty. The average poverty rate in Iowa is 11.7%. People of color under the age of 5 have a 32.1% rate of poverty, 5 to 17, 26.5%, and 18 to 24, 32.8%. Women, people with disabilities, and individuals with less than a high school degree also have much higher poverty rates than the average Iowan. The Iowa high school graduation rate is 90%. But for many racially diverse or lower income Iowans, it's drastically lower, making it hard for them to proceed into career paths that will provide decent housing, healthy food, and good care for themselves and their families. So here's something we hear a lot about, right? Food insecurity, especially lately. It's more real than ever before, and many families struggle with food insecurity, but especially some of our brown and Black Iowa families experience food insecurity, a rate of 1 in 4. There are way too many suicide deaths in our state. In 2020, there were at least 552 that were reported. 77 of those were from people under the age of 24. We know from the Iowa Youth Survey that 20% of 6th, 8th, and 11th grade students have considered suicide. I'm just full of good news today, aren't I? In Iowa, the top causes of death in 2020 were heart disease, cancer, and COVID-19. We know, though, that diabetes, suicide, Alzheimer's disease, and unintentional injury were in the top 10. And Iowa's death rate due to heart disease, cancer, and suicide is quite a bit higher than the US average. So this is all interesting data, and it kind of starts to paint a picture of what creates good health. So what's actually very interesting, I think, is where we put most of our focus is on the healthcare system. But it's actually one of the lesser ingredients of good health. So really, let's think about what does create good health or poor health. Research indicates that for most people, only 20% is based upon experiences inside the healthcare system. 80% is actually coming from outside the system. So how's that made up? Well, about 50% is based on your education, your job, the community you're in, the physical environment you're in. Once those factors are set in motion, this can lead to health behaviors that account for the other 30%. So as an example, if you grow up in poverty and you lack food or an education or a job with a living wage, odds of living a healthy life go down dramatically. So while Wellmark wants to spend its efforts within the healthcare system, we know we need to also work upstream as champions for better health outside of the healthcare system, where our health is actually created. So let's look a little deeper at a person's journey and all the things that need to go right for them to live a happy, healthy life, or a long, healthy life. This slide depicts a pretty simple model of a complex problem. On the left-hand side, this is where our health is created. It's the belief systems and norms that we grow up in. It's the policies that are in our political jurisdiction. It's our living conditions, the house we live in, the job we have, the support systems we have. That's where our health is created. On the right-hand side is the healthcare system, where people largely seek care to be cured or treated. And we know that the US spends more per capita than most other countries on healthcare, yet we have.
Tell me what's wrong.
Yeah, that is, somebody else is upset about this too. That's good. Wellmark is going to continue to work on that right-hand side, in the healthcare system to improve quality and provide access to care. But we know that we have to go deeper on the left-hand side, the root causes of health. The health of any person is largely created in the community where they live, work, and play. So we know that there's no single intervention. This is pretty complicated stuff that will provide health equity, and no single entity is going to solve the issue alone. So how do we start to create equity for everyone? First, let's talk about equity and equality. What do we really want? So I want to level set on a definition. Equality is giving everyone the same thing without recognizing it might not meet them where they're at. So I want to challenge each of you. You can either take me up on the challenge in the chat or not, but I want to challenge each of you to a foot race. And I'm not very athletic, so this shouldn't be too tough, but I'm going to bet you each $10 that I can beat you in the 100-yard dash. Fair? Does anybody want to take me up on that? And in addition, I'm going to make sure this is fair because I'm going to give you a pair of running shoes just like mine. I have great running shoes. They're Brooks, women's size 8. I'm going to give you everybody wants to race me. I'm going to give you a pair of those shoes. And that seems fair, right? Because we all need the same tools to run the race. Well, of course, that's not fair. The problem is my shoes might not fit. And further, you might not even know how to put my shoes on. So we probably really want equity, right? We want everyone to get a shoe that fits and teach them how to put it on so they can run their best possible race. So some have said that equality is providing an open door to everyone that has a means to walk through it, but equity is really about making sure everyone has a path to the door. So not only are some of our health outcomes not fair, but not having equal health outcomes costs money. So this is a Deloitte study that suggests that by 2040, the US will spend $12 trillion on healthcare, with $1 trillion being due to health inequities. Those are big numbers. In fact, if somebody would like to count the zeros and put them in the chat, that would be helpful. I can't even think I know how to count those zeros. So we need to, if we could take 1 trillion out of that cost, that would be really helpful. Today, that amount is 320 billion. So to begin to curb costs, it's not only not fair, it's a cost thing too. So I would argue that addressing health equity is not only the right thing to do, it's imperative to keeping health costs in check. And it's also vital to our economy and even our security. Look at the health disadvantage that we have in terms of disease prevalence in the US compared to other countries, and the fact that we spend more on care with worse outcomes. So as more people get sicker, where is our workforce going to come from? How are we even going to defend our country, at the worst case scenario? So all of this gloom and doom leads me to the fact that we all have work to do. And so we're wanting to get busy. And first, I want to share with you kind of Wellmark's plans, and then let's think about what you can do, or better yet, what we can do together to work on some of these issues. So this year, in 2020, as a company, Wellmark decided we not only wanted to spark a culture of health in communities, but we also wanted to address, on a broader scale, focus on health equity by addressing social determinants of health in a bigger way. So we know that people think of us as providing service to Iowans and South Dakotans that are our members and that carry Wellmark insurance. However, some external research has indicated that citizens expect us to play a bigger role in the health of Iowans. So Wellmark has established a new division of health equity, access, and improvement, and it's led by one of our most seasoned senior executives, Laura Jackson. So we began planning the work of this division with just some basic beliefs. First of all, our North Star is we inherently believe that everyone deserves to live a long, healthy life. Secondly, we know that a strong economy requires healthy people and vice versa. So the US health disadvantage that we talked about is a real threat, but businesses can't thrive and reinvest in the community without a healthy workforce. So as we looked across the state, we realized that there's not any one entity that's capable of addressing all this alone. So we felt compelled to at least step up and try and take a little bit larger role, which is why we've created our new division. the health of our residents, your residents in your communities is largely created in your community where you all live, work, and play. So there's no single intervention that will produce health equity. No one entity can do this alone. We're going to need coalitions to maximize collaboration. We're going to need to deepen our partnerships. We're going to need to measure our collective impact and create structures that hold each other accountable to address health equity. Working on these coalitions is going to be the full-time job of our new division. So the plan is to work with state and local leaders to make positive policy, system, environmental changes that will lead to better health for all Iowans. As we've broadened our mission, working outside the healthcare system, we have used data to identify 3 areas of focus that will be critically important to our 2 states and ultimately our economies. The first is community health improvement. In the last 3 decades, our obesity rates have doubled. Today, only 27.1% of Iowa adults, that's 1 in 4, and 60.5% of kids, 6 in 10, have healthy body weight. This is troubling because obesity drives 30 to 50 chronic diseases. And not only does this not allow us to live our best lives, but it costs a lot of money. So we know that diabetes is related to body weight in some instances. Diabetes alone, according to a 2021 US Surgeon General report, costs US employers close to $90 billion a year in just indirect costs. So that does not have anything to do with the cost of treating the diabetes in the healthcare setting. That is just the cost to employers for employees that have diabetes and the indirect costs. So we know we need to continue to focus on community health improvement because the health of all Iowans is important. So we're going to use the assets of Healthy Hometown, which have tactics for eat well, move more, feel better. But we're also going to layer in health equity as we move forward. So again, those that have a high school degree or less, median family income under 50,000, or a racial minority have more bad health outcomes and behaviors. So we're going to address this through Healthy Hometown, but what will that look like? For those of you that have not been familiar with the Healthy Hometown initiative, we basically provide communities with 3 things to address community health improvement. First, we have a toolkit of evidence-based tactics that are centered around ways to help your residents eat well, have good nutrition, move more, be physically active, and feel better, be socially connected, and have nicotine cessation. So that's the first thing we do. The second thing we do is we have a process and facilitation to develop and organize a plan for each community. And the third thing is we have the expertise and consultation to help execute. So we've worked with many communities, including, I'm sure, many communities on this call with Healthy Hometown. And the initiative is focused on the broad population. So for instance, in the Eat Well area, communities might do things like establish a community garden or healthy concessions so that all citizens have access to fruit and vegetables or healthy options. In the Move More area, a lot of emphasis is on complete streets, walkability, bikeability, assuring everyone can get out and be physically active. And then the Feel Better, social connectedness, volunteering, and placemaking are big things, along with nicotine policies. So those are the things that we've been working on with communities. So you might want to know then what will be different moving forward. To ensure that we have the greatest impact, we want to take a data-driven approach to select maybe fewer communities where we can have a bigger impact. But we still want to assure that we're working with communities that have leadership that's motivated to address community health improvement and health equity. So we're still going to address social determinants of health for the entire population as it's related to physical environment, access to food, and community and social context. But we may focus some of these tactics on a specific population. For instance, tactics that encourage breastfeeding may be targeted to lower income mothers. We're also adding a health equity track. So Eat Well, Move More, Feel Better. We're adding a health equity track to the toolkit. This will focus on evidence-based solutions in addition to additional social determinants of health areas, including education and literacy, economic stability, and the healthcare system. Examples may include mentor reading programs for grade schoolers, or assuring access to economic assistance programs for those participating in training such as apprenticeship programs, or providing student loan forgiveness to healthcare providers that locate in areas of need. So the plan is to follow the data, find motivated community partners, to address both broad community health as well as working on social determinants of health that will drive more equitable health outcomes. So that's the community health improvement area. The second area of focus will be health equity. We've already touched on inequities due to education, income, and race. We will focus on state and regional projects in this area that address health equity. And you know this is important because you see the statistics that tell us that female students of color attempt suicide at a higher rate than their white peers, that Black and Hispanic women don't seek prenatal care as much as their Caucasian counterparts. These data points are just the tip of the iceberg. So one example of our health equity work can be seen in how we will deploy the resources of the Wellmark Foundation. Traditionally, we have focused our foundation spending on physical activity, healthy food consumption, and food insecurity. Over the past year and a half, we've started working with Iowa Jobs for America's Graduates, or IJAG. Those of you that are not aware of the Jobs for America's Graduates model, it's a national model with a footprint across 1,500 communities that impacts 76,000 youth annually. This is a nonprofit that connects business and education to provide cost-effective dropout prevention and school-to-career solutions. In Iowa, they have an affiliate called IJAG. It began in 1999, started in 6 locations and served 150 students. Today, there are nearly 150 chapters serving 6,000 students this year. The funding model is based on state funding, local school funding, and private sector support. So it's highly supported by the private sector. In 2021, the legislature made an additional investment with the goal to get to 200 chapters. So IJAG boasts a 98% graduation rate, and 60% of the students enrolled are racially diverse. Now, you might recall from my previous comments that Iowa has an overall 90% graduation rate, and IJAG has got a 98% graduation rate, and they're starting with kids who are challenged with the education system, and so need to learn a little bit differently. So we think that that's a pretty good outcome. So the Wellmark Foundation is in its second year of a partnership with IJAG, where we helped fund the Student Leadership Development Conference and Career Development Conferences. So as an example, at the state level, at the Career Development Conference, all the students come to explore careers, work on resumes, and practice public speaking and interviewing. We've incorporated, with the partnership of some healthcare providers, healthcare systems, a hands-on healthcare career exploration track. So we think this has a kind of a triple impact. First of all, it helps with getting those students through high school, and it helps expose them to these high demand careers. But this may also help recruit more healthcare providers that are really badly needed, and hopefully be a start to get more racially diverse provider network in place that will encourage minorities to utilize the healthcare system at a higher rate, because maybe more providers will look like them and share their culture. So that's one example of how we might work on the health equity issue. And that, of course, is way kind of upstream. So here's our final focus, and probably of interest to this group, and it's rural health. A final focus for now. We might have other areas of focus in the future. So we previously talked about the fact that 10 counties make up more than 50% of Iowa's population, and then urbanization has often left rural areas with sometimes less money, and older population, and poorer health. And in some cases also less access to employment, education, and healthcare. So here's an area you guys are all experts in. So you're experts, so you know that the work to address rural health and equitable access to not only vital services and healthcare, but health outcomes isn't going to be easy. So beyond our healthy hometown work in rural Iowa communities, some of our initial work in this area started in South Dakota. So I'm not going to go into a lot of detail, but we worked with a provider system that was interested in establishing clinics in rural areas that would connect to a high-tech virtual health facility. We collaborated with them to analyze health and demographic data and gather community information to help narrow potential locations for these clinics. So those are the 3 areas of emphasis to start. We understand that these 3 areas of focus aren't tidy little packages. Some of the issues will have different solutions depending on the lens. For instance, in the area of maternal health, you may have racially diverse mothers that are not getting the care they need due to their culture, whereby in rural areas, it may be an access issue. Perhaps they need blood from mothers that hemorrhage and need a transfusion, and that's the real issue for them. So we know it's not one size fits all work. That's why we need separate plans for each of these areas of focus. So you may ask, how are we going to go about our work, or how are we going about our work? Well, if you start on the left-hand side of this slide, I see some of our partners were in attendance. In fact, we're working with state government and universities to develop broader sets of statewide demographic and health outcome data that will help us identify root causes. And we are also then researching and cataloging the best solutions based on national and local best practices. We're looking at what's going on in each state, and so that we can marry a solution with the root cause once it's identified. We're identifying partners and collaborators because we think there needs to be a portfolio of projects in these areas that are short-term and long-term in nature. And then we are, as I said, aligning the assets that we have, Healthy Hometown, the Wellmark Foundation, to help deliver on these action plans. And measuring success is always important, and we hope to learn from these initiatives and improve for better delivery down the road. With that said, let's talk about maybe what you can do, or maybe better said, what we could do together. So Wellmark's going to continue to work with providers to reduce the health cost and improve quality of care. But we believe that we have to go upstream in a coordinated manner, working together to address the root causes, not just the fallout from poor health. This is really important, and it has huge economic implications for our communities, our state, and our nation. We can't manage 12 trillion in healthcare spending as suggested in healthcare spending in 24 as suggested by Deloitte. Please know that as we develop an Iowa-specific plan to address each of these 3 areas of focus, we look forward to working together to assure all Iowans have the opportunity to live a long, healthy life. If you think about it, what are the top health and/or health equity issues in your community? Start putting those in the chat, and maybe we can have a conversation about that in a minute and what we can do about it. As you think about that, I want to help you with some possibly some ideas. We know many of you have already started this work, and if you have, that's great, but maybe there are other things you can do. To spur some thoughts, there are things like helping schools by developing supports to assure grade schoolers have basic skills, or implementing programs to get at-risk students a high school diploma and get them into decent job or advanced training. Helping employers to understand diversity and to create a culture and policies that will help diverse employees thrive, or assuring that residents who are falling on hard times know how they can get their basic needs met until they can get themselves in a better place, or training more diverse healthcare providers so diverse patients can identify with their provider. You can see there are a lot of things that can start to have a big impact on those with the biggest health disparities. And so I'm interested in your ideas on how we can partner to do that. So in closing, I'd say individual health and health equity is priceless for a lot of reasons, and achieving it is going to take all of us. So I know many of you are already taking steps, and sometimes some of you are taking big steps. But if you're already doing it, let's bring another person, another group, another company along with you. I think everybody needs to find a reason to care and take action. So you can ask yourself if your community can find a reason to make bigger impact on your residents' health and health equity. If you think about our future, helping everyone makes communities stronger and enhances our economic vitality. So thank you for your time and interest in this today, and I do look forward to a conversation.
Okay, Mary, we have a chat question from Joseph Collins. Could you elaborate more on your plans for education literacy strategies? I work for the Iowa Department of Education and would love to chat more about how we might be able to partner with you, if not already, to address some of the disparities you're seeing with education and to better connect community members to education, training needs, adult, youth, workforce, etc.
Mm-hmm. Yeah.
Hey, Mary, can you stop sharing your screen so we can see you bigger?
Sure. Are you sure you want to see me on a Friday? It's scary.
You bet.
There, is that Is it not sharing anymore?
Nope, you're good. Thank you.
Okay. Yep, absolutely. So education, there's a couple things we're doing, and we are just beginning the work of our division. So the work will grow. We do know that if we need to get kids through high school and into career paths in order for them to have better health outcomes. And so we have items that we build into the health equity part of the Healthy Home Toolkit that would be things that are evidence-based, like literacy programs for grade school kids and mentoring reading programs, and then everything through to the investment in IJAG to help get those that are at risk of not graduating to get them a college, or excuse me, a high school diploma, and hopefully into a career path. So those are a few of the things we're working on now. But as I said, we're at the beginning and we're open to partnerships and the most impactful way to get these things done. We have to search for the most efficient and impactful ways to do this work because there's so much to do. So if you have ideas, yeah, please reach out. Let's meet and talk about it.
Another question that's come up is, how do communities really get involved with the Healthy Hometown Project? And then can you give good examples of what communities have done after participating and while participating in this program?
So that's where we're reimagining how Healthy Hometown is going to be used. So previously, so I'm going to start a little bit further back. So some of you might be familiar that from 2012 to 2016, we had the Blue Zones Project, which we had contracted to have the Blue Zones Project in 15 Iowa communities. And we basically did a post-mortem with the communities that had participated in the Blue Zones Project to learn how we could kind of insource and create our own program, which is Healthy Hometown. So what we learned was that those that participated in the Blue Zones Project really had a lot of great change in their community that went broad and deep, and it felt like it created a culture for the community of health, such that when they're making policy decisions or they're developing a street or they're thinking about concessions, they're kind of automatically defaulting to making their streets walkable, bikeable, thinking about adding healthy options to their food environments. It sort of became what they do in their DNA because it was so deep and broad. But what they also told us is it didn't feel very good because they didn't have a lot of decision over what they could do. So we intentionally designed Healthy Hometown to get to any Iowa community that wanted to do it. If you had the leadership in place, you could show you had the leadership and the desire to do it, we would come help you. And we had the menu of things that you could choose from. So it's sort of like going to a restaurant and the community ordered off the menu. Well, we've now done kind of a listening tour with many Healthy Hometown communities, and they felt better about Healthy Hometown because they were choosing what they wanted to do, but it really wasn't going because they weren't being pushed to do more. It wasn't creating that culture of health. And so what we are now doing is still working with some of the communities that we've been working with, sort of teaching them to fish, but we are looking at data to see what communities maybe have the deepest problems. And based on that data, we'll be having conversations with communities to see if they have the interest to kind of go after the work in a broader way, more evidence-based, data-driven way. So that's my long way of saying previously it was kind of like, put up your hand, get your leaders in place, we'll come help you, choose what you want to do. But in the future, I think we're going to probably work with fewer communities in a more strategic way based on data and a broader toolkit that includes health equity. Does that make sense?
Hey, Mary, I'm going to jump in real quick. Everything you're saying today has me thinking about our next Rural Summit next April in Ames. Our opening keynote speaker is a woman who runs a highly, regarded food blog called Food Tank, and she talks about food systems and food access. And then our closing keynote speaker is actually a woman at the Minnesota Department of Rural Health who's going to talk about isolation and loneliness in rural communities and how communities can start to address those things. And, you know, everything that Wellmark is proposing to do with this new process aligns with these sorts of issues, which have been coming up repeatedly within the Rural Development Council in our conversations. You know, access to a place to live, a good job, clean water, you know, schools, healthcare. I mean, these are all elements of a vibrant community. And it seems like some of the things we're going to be talking about at the summit next April are going to align perfectly with where you're going.
That's great. Yeah. You know, it's interesting. We found that you folks, the Rural Development Council type members, have been our best partners because it's interesting how aligned the sorts of things you implement to have healthy citizens align with the things you do to make your community economically vibrant.
Mary, you talked a lot about involving the private sector to assist with funding on programs. What are some suggestions you have in getting that private sector, our private companies in our communities excited and involved in these efforts?
Well, you know, I think it's a heart and a head thing. So I think you have to tell the story. I mean, some of the data that I tried to provide, the cost of diabetes, not just, you know, in the healthcare system, but the cost to employers. And the fact that if you don't have healthy people, you're not going to have a workforce. And some of that workforce is going to be those that maybe they haven't traditionally thought about before. And some of those people are at the biggest risk of not having good health. Perhaps if they had good health, they'd have more of a workforce. I think, you know, it's when you think about how you approach people and what's in it for them. With the employers, it's always more the head side, well, often more the head side than the heart side. You know, they care, but it is a dollars and cents thing for them too. And, you know, I think using some of that data to make that case can really help bring them along, hopefully.
We have a little bit more time. Are there any other questions for Mary?
Well, I don't want to dominate, but Mary, you know, as someone who has helped to review your past grants, you know, in reality, you know, will there be opportunities for communities? Again, the Rural Development Council has our own Power of Connection grant program, and we have aligned with some of your communities like that in the past. But from a strictly grant-making standpoint, is your change in direction going to change the way you make strategic investments in communities?
I think in 2023, we will have another physical activity match grant and healthy food match grant round. But we will be focusing more on special projects in the future than we have in the past, and strategic alignment with organizations like Iowa Jobs for America's Graduates and those sorts of things. So I think we'll continue to see grant making, but we'll see more special project work that's working with partners and designing projects to go further upstream than we were on physical activity and healthy food to start to look at some of these underlying health inequities.
Any other questions? Well, seeing none, thank you, Mary. This has been
one
very. Oh, go ahead.
Mark,
Go
sorry,
ahead.
I put one in the chat box. I'll just go off and mute.
Okay.
I was just curious, and my apologies, Mary, if I missed it, but what does the consultation process look like? Are you physically going to the community? Are you bringing partners with you? Could you run through that? And again, my apologies if you ran through that. I might have missed it.
Yeah, so previously, yes, we've been in the communities and we'll continue to come to the community. So we have community health managers. A couple of them are on this Zoom that go to communities, work with them. As I said, we have Healthy Hometown has typically brought the toolkit of evidence-based interventions. We're adding health equity to that toolkit in addition to Eat Well, Move More, Feel Better. We have a process to facilitate a plan for the community, to put a plan together for the community on what they want to get done. And then our community health managers have expertise to help you get it done. In the future, that will look a little different. It'll be even probably more hands-on consultative for those communities we're working with, because we've started analyzing a lot more data and learning a lot more about a community as we start to work with them. And so it's not just as much pick off the menu. It's us consulting with, well, here seem to be the issues in your community. So here would seem to be the evidence-based things that you could do that would most closely align to your biggest issues. And kind of a conversation then with the community on, if you agree that you can work on these things, we'll provide the consultation and be in the community working with you.
Thank you.
Yep, thank you. I see a question, what segments of the population are you working with? Well, we'll continue to work with the communities to implement things that impact the broad population, but then it will determine, first of all, at the community level, the demographics of the community will probably drive, what parts you'll be working with. But initially for our more regional or statewide work, we're working on health equity. And so, I talked about those that are from lower income families, don't have a high school degree or less, are racial minorities. And then we're also focusing on rural health, so the rural segment. So for regional and statewide projects, those would be the emphasis. Within communities, the makeup of the community would drive us towards what segments of the population we might focus on, in addition to doing things for the broad population.
We have another question. How does this shift impact your grant periods or length of time you are working with a specific community?
So in 2023, the grant periods are the same. The difference is we went from large and small to physical activity and healthy food, and those will look the same as this year. I think the amount of time we're working in a specific community will depend upon the community and the work that needs to be done, and the ability of the community to get the leadership directed at that work. We will probably work with them as long as it takes to be successful, as long as the community is willing to work with us.
How large when you go into a community, how much of a team do you expect the community to have? How large of a group of committee members type thing?
Well, that's sort of a art and science thing. You need enough people to lift the work, but some of it is making sure you have the right people. What we found is you can't do it without the support of the city government, city manager, mayor, council, that sort of thing. The economic development groups are always very important. The school, the civic groups of the community. And you all know this better than anyone. There are just some of those volunteers that are the get it done people. And that's different in every community. But we up front do a lot of meeting with community members, ask a lot of questions, making sure that we understand the community dynamic. And so that looks different in every community, but almost always we can't do it probably without the city leadership, school leadership, economic development leadership, oftentimes hospital administration, public health, those sorts of organizations.
Thank you. We have a couple other questions. Is there any discussion around assisting with rural healthcare providers and their struggle to hire talent in high demand areas like mental health, nursing, et cetera?
Yeah, we're very much open to those conversations and interested in the topic. The healthcare shortage, that's one of the reasons that we're working with IJAG we literally said, look, we want to support IJAG, but we want to do it in a way that addresses other social determinants of health. So that's why we chose to specifically carve out, we want to expose these kids to healthcare careers. And so that's one reason. A lot of them don't know anything about it. So we now have done 3 very hands-on sessions where we've had the healthcare provider system come in and have rotations that, one of them actually chose the kids. They actually let the kids work on the dummies or whatever you call them that you actually pull blood out of, actually show them the surgical tools and let them look at them, feel them, let them look at the pediatric mannequin and do a checkup on it, actually bring the bones of a skeleton and show them where it's at in their body, and talk about what the different career paths are. So that's one thing we've been doing to try and work on the healthcare, the healthcare shortage. But there are other things we could do, and we're very open to the conversation, especially in rural Iowa. I know it's hard to get providers.
And another question that's pretty much add on to what we just discussed. I understand that you have target groups, but are you working directly with that population to know exactly what they need?
That's, if we get in a community, that's what we would suggest. If we're in a community, for instance, that has a high Hispanic population, we would say, well, where's the Hispanic, rep in the leadership? At the state level, we probably need more voices. We're in the beginning stages of our planning. So for our rural equity focus, we probably need to have more conversations with you all and make sure we really understand the problems. And on the health equity, those that don't have high school diplomas, lower income, minorities, we need to absolutely listen to those voices and probably do more of that. Like I said, we're beginning stages, just started this division in the past 6 months. So yeah, that's a great point and a good reminder.
Okay, I see that the questions have somewhat ebbed. So we'll try this once again. Well, thanks, Mary, for providing really great information today. The IRDC, with what you just indicated, we look forward to assisting you on your health equity efforts in rural Iowa. And hopefully there's going to be many ways that our members and our organization can assist you in accomplishing your goals as you go forward. So thank you.
Well, we hope to assist each other. So thank you and happy holidays to everyone.
Thank you very much. Couple of last notes, as Bill referenced, April 11th through the 12th will be the Iowa Rural Summit in Ames this year. So put that on your calendar. We're already getting good sessions lined up. And as Bill indicated, speakers, we are continuing the Zoominars during 2023, and we will be letting you know we have Zoominar topics, I think, setting up for January and February, but we are always looking for new topics. So if you have some something that you want to bring forward or aware of a good issue that we need to be addressing, please let us know and we will have that set up in a Zoominar. Other than that, thank you everybody for attending and have a great holiday season coming up. Thank you.
Thank you.
Thanks, everyone.